calcification. So this is a needle going into the calcification, and basically we're breaking it up, destroying it, and sucking it back out. So that's this white stuff in the syringes, the calcification coming out. So we can localize the area, we can insert needle, we can do procedures into it to help fix the problem. Here's a video of what it looks like. So here's the needle going in to the calcification. So we're basically pushing in fluid, breaking it up, and then sucking it back out. So this was on the sideline. So this was a football player who went down. He got tackled, basically got smashed into his quad, and he ended up bleeding. So this really dark area here is a pool of blood. And the problem with this is that it expands and can prevent the muscle from contracting, and it doesn't go away. And so this is one of those things in which we actually have to drain it. So we have to put a needle in, drain it, removes the blood, the muscle starts recovering much faster, and also prevents other complications. Ankle sprain, so fibular fracture right here, going through the syndesmosis. So this is a high ankle sprain. These are really nasty. These take a while to recover. This is a season-ending kind of injury. So here's an example of it on X-ray, and here's an example of it penetrating through on ultrasound. So I see these lines going through here, line going through here. All right, so here's an example of just a hand case. So this gentleman came in complaining of pain and swelling in his finger here, and couldn't see anything on X-ray, couldn't really see anything on his exam, but his finger was swollen, it was inflamed. So started scanning it, we saw this huge amount of fluid within the tendon sheath and this bright white dot, which is a foreign body. That should not be there, that's not normal tissue. And then you see these bright white dots again here and all the swelling and inflammation around it. So picked up on this, couldn't exactly tell what it was, so he had to go to the hand surgeon. So the hand surgeon had to open him up, and then you see right here this line right here, and this is what came out, these little things right here. So they were foreign bodies, and so then you start talking to him a little bit more, and oh, by the way, I went scuba diving in Hawaii, and you know, we ran into some urchins, and so those are urchin spikes. So they penetrated through his glove and they got into his hand, and so he had a foreign body reaction to these urchin spikes, and that's literally what they are. Okay, so this is another thing I do in office. So this is treatment for chronic tendon problems, so Achilles problems, plantar fascia problems, tennis elbow problems. Basically, it's a device here that goes into the damaged tissue, cuts it, removes it, and helps it heal. So here's a nice little cartoon illustration of what this is. So we make a little puncture site in order to open up the skin. We line up our ultrasound to see the tissues. We pop in the device here through the puncture site, and then it goes into the damaged tendon. So all this dark stuff is the damaged tendon tissue, and up here is supposedly healthy tendon tissue. And so put the device into the right spot, it starts pushing fluid in, and it starts cutting and vibrating, and basically sucks the fluid and the debris back out. And so this helps remove the damaged tissue and helps the tendon heal and recover to become more normal. You can think of tendons as being elastic tissue, like rubber bands. So when they're damaged, they're not as elastic. And so we're trying to promote the return of elasticity and make them more functional again. So this is what it looks like on ultrasound, and all these bright dots here are new vessels, you know, damaged tendon tissue. And so when we're looking at, this is a tennis elbow case. When we're looking at the damaged tendon, this is what it shows up to us and tells us there's a problem. And that's where the problem is. And so then we can go in directly. And so here's the device going into the damaged tendon tissue, going back and forth, vibrating. Here's a little spur right here. It's pushing fluid in, sucking the damaged tissue out. So this is something we're able to do. It's minimally invasive. The recovery time is much quicker than a major surgery. So athletes get back to play, you know, in a couple months. Here's an example of an Achilles. So this is what it looks like when we're actually doing the procedure. So this is the ultrasound transducer. This is the device. So we're inserting it into the Achilles, and more specifically, there's this calcification and tendon damage right in here. So the device is going in here, and it's cutting and sucking and removing it.
What's the recovery time for this kind of Achilles injury?
So after this procedure, she got back to the activity she wanted to do in 6 weeks.
Wow.
So she was walking, jogging at 6 weeks. Now, she wasn't running track. So she probably needed, maybe 3 months full recovery to get back to full track activity. And so here's another thing we do. It's called platelet-rich plasma. So in this example, this is a tennis elbow right in here. So this area is the damaged tendon tissue, and so you see the damaged tendon right in here, inserting onto the bone. And so this is what happens in overuse, typically in tennis players. We see it in golfers too. And so what platelet-rich plasma is basically your own blood. So here we are drawing out your own blood. You're taking, looks like a small amount, but we actually take 60 milliliters, which is a very, very large amount. So we take all this blood and we put it into a special centrifugation system. So what we're doing is we're separating out the components of it. So we're taking growth factors, we're taking stem cells, we're taking platelets from your own body, and that's what this is showing here. It's separating it out, and the top layer is this platelet layer with all the growth factors. And then taking the top layer and basically removing it, so you're taking all that out. And that's what this syringe represents. And then going back to the damaged tendon and putting the needle in. Well, first you gotta line up the transducer so you see where the damaged tissue is. So here you're scanning, you're seeing it. So you're putting the needle into the damaged area, and you're injecting these platelets and growth factors and stem cells in the damaged tissue to promote them to heal. You're also going into the damaged tendon fibers here, and what this is showing is that you're basically poking some holes in there to open it up, to allow it to accept the new platelets and the new fluid that you're pushing in. So you're pushing in the platelets and growth factors in here, and you see these tears. So the cartoon is basically demonstrating that these things magically heal the tendon, and everything kind of comes back together and looks normal. So this is a big component of orthopedics and sports medicine right now. It's trying to heal damaged tissue. And so there's a whole area called regenerative medicine, which we're taking blood, stem cells, growth factors. The athletes are always going to different countries to get them because some of it's illegal. But basically to try to keep them going. I mean, Kobe's had this done 1 million times into him, but most athletes, they're getting all this stuff done all the time to keep them going. The main reason why is because things wear out over time. Tendons will wear out over time, joints will wear out over time. And if you're playing at a highly competitive level, you take a beating, especially if you're doing tackle football like you saw in the video. These guys are getting beaten up. So things break down, they wear out, and if you go in and you do major joint replacements and major surgeries on these people, you can end their career. So you end their career, you end their job, you end their livelihood. So what can we do to keep them going that doesn't end their career? And this is one part of it. And that's all I got. Any questions?
Yeah. Back to the head concussions. You mentioned it's mostly evaluation beforehand. There's no diagnosis until they start getting symptoms. So is that often just kind of like a patient-to-patient thing, whether or not they attribute symptoms, you still have to watch over them over time, after a year after the incident, or how long?
I mean, concussions heal. So if you look at the standard healing time after that type of head injury, the average is around 14 days. So on average, most of the symptoms go away over the course of a couple weeks. There can be some lingering issues that occur, and we address those over time. Sometimes it's related to the eyes, vision gets thrown off. Sometimes it's balance. So those things we address over time. But by definition, a concussion is just a mild injury, so you should recover. You should get better. Now, if you have something that's going on for a year, that's a more significant kind of brain injury. So we see those, people are bleeding into the brain. Sometimes they have permanent damage. In the sports world, that's unusual. We don't see a lot of those. The big issue is getting multiple concussions over time. Do those accumulate? Do those cause long-term damage and long-term problems? And in certain sports, professional level football, yes. These guys have been getting hit over and over and over again from high school, college, to professional level. And so you do see an accumulation effect. But in most other sports, you don't really see that.
A famous footballer, Robin Van Persie, is kind of known for having these unusual platelet treatments, including the horse placenta that he goes to. You know, obviously.
We're using human placentas now, actually.
Human placenta. Well, I know he's doing. Can you talk a little bit about, like, you know, the placenta treatment? It seems like that's kind of a way for the future in terms of trying to heal modern athletes.
So they're using amniotic membrane, amniotic fluid, in the idea that it has some stem cell components. Honestly, there are other parts of the body that have better stem cells. So bone marrow is sort of the wave of the future. So now we're going to bone marrow. Even in the fat cells, you can remove fat cells and get stem cells. And so all of these regenerative techniques are trying to get at these cells that supposedly can change